Let's take you now to the Northwest, and that's where the Health Department and other stakeholders are meeting in Mahikeng today. At top of the agenda is a report into the state of the public health care system in the province. The state of health, the details that will come out of this have to do with the challenges, including the ongoing medicine shortages, long waiting hours for those who need medical care, and the slow progress in ARV refills. Newzroom Afrika's Refiloe Seboko following that story for us. Refiloe, good morning to you. So quite a number of challenges, I would put it, that face the health department in the Northwest province. Just explain in much more detail than what I've just said in that introduction, what actually is going on relating to the health department there.
Well, quite a number of challenges that also indicated by the number of testimonies that we've been hearing from community members. Some are saying that the issue of long waiting hours that they have to enjoy in these health facilities in the province, and also not only that, but also as they are waiting for their medication, they'll be told, one who says that I arrived at the clinic at around 7 o'clock in the morning. By 3 p.m. I was told that the medication is not there, having waited for that long. And some are saying that we're taking some days off from work to go to these facilities to fetch our medication. But those are some of the challenges that they are faced with. But I'm joined by an official from Ritshidze who's going to tell us about their investigations, but also this report. What is it that you have found about the state of healthcare system in the Northwest Province?
Okay, so as Ritshidze, this is our third edition of the State of Health of Northwest, and we have found that there has been a slight improvement in the waiting times, where patients are waiting for over 4 hours after the facility opens to be assisted. However, there are some facilities that are not doing as well, specifically in Bujanala and Dr. Kenneth Kaunda, where we have patients waiting for over 6 hours to receive services. And some of these issues are exacerbated more by the issues of lack of staffing. We have over 50% of facility managers who've stated that they do not have enough clinical and non-clinical staff in their facilities, and this really does put a burden on the specific facilities in giving services to patients when they do come to the clinic.
And you also talked about recommendations going forward. This is the third report. You've seen some improvements, but there are still some challenges that the department needs to attend to. What are those some of the recommendations?
Specifically, when we talk about like recommendations around stockouts, when we talk about recommendations around staffing and key populations, we have asked that the department fills all the vacant vacancies within the province by September 2023. This is just to ensure that facilities are stocked up with the personnel that is required, because if you notice in the report, facility managers state that they really need professional nurses. There's a lack of enrolled nurses, assistant pharmacists and pharmacists, people who actually should be taking care of the stock in the facilities.
How much of a concern is it for you as Ritshidze? What should be their main focus in terms of, you talk about issues of stock out in medicine, waiting period, treatment of patients, amongst others?
Ideally, all of the issues are issues, because this is what stops us from attaining the 95 targets. So when we speak of KPs and sex workers, trans people, people who use drugs, and gay, bisexual men who have sex with other men not being able to access services, it becomes a very big challenge. Services should be available, and people should not be discriminated according to their sexuality or who or what they identify as. So all of these issues become issues, because if we sort all of these things out, it means that we are fixing the healthcare system. If we fix issues of long waiting times, if we get stable people who are living with HIV who are on treatment out of the facilities, and we ensure that we've got external pickup points, whether they be located in the community, and we ensure that we decongest the facilities, where in most instances, if you hear some of the testimonies, people are literally just going to the clinic to collect their treatment, and about 61% of people who we spoke to stated that they would like to collect their treatment close to home. So let's open it up to those CBOs, let's open it up to creches where people can just go, you collect your treatment, you go home, and then obviously if you are stable on your treatment. And then you go to the facility once a year for your bloods, for your annual checkup and everything else.
Thank you so much for your time. Let's leave it there for now. We'll leave it there for now, but